Have you or someone you know been taking Prilosec, Prevacid, or Nexium for acid reflux or heartburns? What if I told you that these common drugs used by millions of Americans every day are not only shutting off your symptoms, but silently wrecking your gut health, increasing your risk for infections, nutrient deficiencies, and even early death? I'm not saying this to scare you. I'm telling you this because the truth isn't getting out fast enough. In today's episode, I'm going to break down what these drugs actually do inside your body, how they compare to the old school methods of using food and targeted supplementation, and the dangerous trade-off nobody's talking about. Stick around because towards the end, I'll show you the only real way to heal your gut, not silence it. And yes, it involves enzymes, your microbiome, and restoring function, not masking the symptoms. Let's start with the basics. Omeprazole, which is Prilosec, lansoprazole, which is Prevacid, and the esomeprazole, which is Nexium, are all in a class of drugs called proton pump inhibitors, or PPIs. What do? They block the production of stomach acid. Sounds like a good thing, right? Especially if you're dealing with GERD, ulcers, or that burning acid reflux that creeps up your throat at night. But here's the problem. Stomach acid is not your enemy. In fact, it's one of your body's first line of defense. Stomach acid activates pepsin to break down proteins so you can absorb nutrients, kills harmful bacteria before it reaches your intestines, triggers enzyme release to help with digestion further down the line. So what happens when you block it? PPIs are meant for short-term use, about 4 to 8 weeks, but most people stay on them for months or even years. Let's talk side effects. Here's what the researchers and the FDA tell us. Increased risk of infections, which is a bacteria that can cause severe diarrhea and colitis because there is not enough of acid to kill the bad bacteria. Low magnesium and calcium levels leading to muscle cramps, irregular heartbeats, and even bone fractures. B12 deficiency, which can cause brain fog, fatigue, and nerve damage. Increased risk of kidney disease, higher rates of pneumonia. Some studies even show the link to dementia and early mortality with long-term use. And yet these drugs are handed out like candy. Prilosec alone has been one of the top 10 best-selling drugs in the world. And what's worse, when people try to stop PPIs, the rebound acid effect can be even more intense, pushing them right back into the cycle. Before Big Pharma turned digestion into a pharmaceutical business, people used something much simpler and more effective: food, enzymes, and natural stomach acid. You see, the body was designed to heal with the right tools. Digestive issues like reflux, bloating, and indigestion were once handled by restoring proper digestion, not by shutting it down. Let's break it down. Proton pump inhibitors, those acid-blocking drugs, work by suppressing stomach acid production. Sure, that gives a quick relief from burning or discomfort, but it does nothing to fix the reason those symptoms showed up in the first place. And here's something most people, and even many doctors, don't talk about. In most cases, the burning in your stomach or your esophagus isn't actually caused by too much stomach acid. It's from the wrong environment in your gut. What do I mean by that? For starters, many people with acid reflux actually have too little stomach acid, not too much. When there is not enough acid to fully break down your food, especially proteins, that food starts to sit and ferment in the stomach. That fermentation builds pressure, and that pressure pushes stomach content up into the esophagus, causing that burning sensation. But there's more to it. Your stomach and esophagus are lined with a protective mucous membrane, a natural barrier designed to shield your tissue from the strong acid your stomach produces. But guess what? That protective barrier depends on amino acids, the building blocks of protein, for its maintenance and repair. So if you're not digesting protein well because your enzyme levels are low or your stomach acid is weak, your body can't produce or maintain the mucous layers effectively. That leaves your stomach walls and esophagus vulnerable to acid irritation, even when acid levels are normal or low. And what do in response? We shut off acid production even more. which only makes digestion worse. This is why nutrition, enzyme therapy, and gut restoration are so important. When you support your digestive system properly with the right tools, right enzymes, targeted nutrients, and occasionally even hydrochloric acid support, you give your body the tools to fully digest protein, rebuild and protect the mucous membrane, reduce fermentation and pressure, heal the real root of the acid reflux rather than masking it. The old school way wasn't just about avoiding medications, it was about restoring function. It helped people actually absorb nutrients, protect their gut lining, and stay off medications long term. So the next time you feel like burning sensation, don't just assume it's too much acid. Ask yourself, am I missing the real building blocks my body needs to function? When your body doesn't break down food properly, especially proteins and fats, it leads to bloating, gas, acid reflux, constipation or diarrhea, nutrient deficiencies, inflammation, and eventually it damages the gut lining, weakens the microbiome, and sets off the chain reaction to your entire body: joint pain, fatigue, brain fog, skin problems, you name it. But when you support your body with digestive enzymes to help break down proteins, fats, and carbs, hydrochloric acid when needed to restore proper acidity, prebiotics and probiotics to feed and balance your microbiome, you're not just turning symptoms off, you're turning function back on. Your gut symptoms or pain is your check engine light. Drugs like Prilosec and Nexium cut the wire. Enzyme therapy, microbiome support, and nutrition, they actually fix the engine. If you are tired of masking your symptoms and ready to heal your gut from the inside out, not just manage it, you are in the right place. Subscribe to this channel. Share this episode with someone who's been stuck on PPIs for too long. And start asking, am I supporting digestion or just silencing it? And ask any questions down below in the comments. I'll do my best to help you. If you do not eat and digest food as your medicine, you will end up eating medicine as your food. It's time to make digestion a priority again.